priority in our life, right? So today's topic I am talking to you about the tablets which or the antibiotics or the drugs which you take over the counter, how much trouble it can cost you, right? See the salt which you use for your food, it should be according to it should produce taste. If you put less salt, the taste will be not good. If you put more salt also, you can't eat. Similarly, the drugs which you will be prescribed from a qualified doctor will be according to your disease, right? So either you should not overdo it, or you should not underdo it. So that's how a qualified doctor, a specialist will diagnose your disease. You will see that the diagnosis is proper, the dosage which he prescribes is proper, the duration which he gives will be very proper, right? So I have seen so many patients, especially who are coming from a rural area, who are uneducated, right? Who are illiterate, poor. What they do is they just go to one of the pharmacies, they will just purchase some drug. So when we ask them how much did you give, they said, there was some fever, sir, some for my child. I guess if there is less fever, I'll give you 2 spoons. If there is more fever, I'll give you 4 spoons of syrup, sir. That's what I will do. That's what I will tell. But that's very, very wrong, right? So it's better you show to a qualified doctor and find out what is the cause of fever. I'll tell you one good example. Suppose the child is suffering from viral fever, right? So if the child is suffering from viral fever, there's no need to give the antibiotic at all. So if the child is suffering from bacterial infection, then if the child gets fever, then only you need to give antibiotic. So antibacterial mainly bactericidal and bacteriostatic drugs. Bactericidal drugs are those things which are meant for killing the bacteria. Suppose if you have bacterial infection, then only you will give the antibacterial treatment. Otherwise, you won't get the antibacterial treatment, right? So the antibiotics are needed only if you are suffering from infection with the bacteria. Viral infection, you are not going to take any antibiotics at all. So if you take antibiotics in the case of viral infection, then you may cause much more problems to the patient rather than the benefits. So it's very, very important that you should a qualified doctor find out what is the exact cause for your disease, whether it's a bacterial infection or viral infection. If it is bacterial infection, see the bacteria which cause upper respiratory tract infection is totally different from the bacteria which cause your urinary tract infection or any infection in any other part of some of the body, right? So there are some specific bacteria, specific pathogens which will cause specific disease. So according to that, your doctor will evaluate you, find out what will be the cause of your infection, and you will prescribe the suitable antibiotics so that those particular antibiotics will take care of that particular kind of bacteria, right? Suppose for urinary tract infection, there is a different kind of category of antibiotics to be used. For your respiratory tract infection, there is a separate dosage of the duration of the antibiotic that should be given, right? So better to consult a doctor and have a proper diagnosis, then only better consume the drugs. That's the one thing. Second thing, what happens whenever the prescription is given by a qualified doctor, especially about the antibiotics now, what our patients usually do, suppose if the doctor has prescribed some costly drug, let us see. So if he has prescribed for 7 days, what they will do is, no, doctor has prescribed 7 days, it will be too costly, let me not take for 7 days, I will take only for 3 days, or let me take only for 5 days. They won't take the full course, the one thing. Second thing, they will take the antibiotic for about 2 or 3 days and they will do fine, they will say they will stop the drug. They won't complete the course. See, that shouldn't be done. So just because doctor has given the course of treatment, you need to have to follow the course which he has advised. Suppose the doctor has advised, depending on the